is a 40, and we know that is very rapidly declining based on the assessment. She will meet criteria just based on the FAST score. So based on the assessment, we're going to go ahead and we'll review the medications
Sure.
of what's appropriate and what's covered and non-covered.
She actually is currently only taking the Seroquel at night.
Which is covered.
Yeah, she's unable to swallow pills at this time, so her daughter has requested us to discontinue all meds except for her comfort medications and that Seroquel that she can crush up and put in pudding.
So all meds remain appropriate, as their comfort pack and the Seroquel. And now we'll go on to psychosocial report and concerns based on the decline and such.
Yeah, so as it was mentioned in the nursing report as well, the patient has been combative with her husband and other caregivers. Additional stressors include the fact that she was recently relocated to a new home. She's now living within that multi-generational home setting with her daughter and son-in-law, as well as the patient and her husband who will be living there. So a lot of different folks in the household, which is, you know, on one hand good for the support, but it is an adjustment for the family. Overall, her disease is progressing rapidly, as we discussed. So I think, you know, the family are just trying to cope with the changes that they're seeing on an almost daily basis. So definitely adjusting to the new environment, change in status, and this recent admission to hospice, and decision that the patient needs hospice. There are also new roles within the family system as they're kind of becoming more blended. So I think overall there's just an increase in stress, potential for increased stress to the family at this time. So I just want to note also her daughter is a nurse. So she's kind of in a dual role right now, being, you know, caring for her mom. So that puts her in a little bit more of a vulnerable position as she's, you know, coming at it from a nursing perspective, but also very emotionally connected to it. And there is also a 3-year-old who's living in the home. So we just want to keep in mind they're likely aware and seeing some of the behaviors that the patient is exhibiting. So those were the kind of big issues that were kind of pulled from my initial psychosocial assessment.
And also we'll need to monitor the husband and his acceptance in this
Yeah.
issue as well, because they've been married to a lot of years.
64.
64 years.
That's a lot.
But due to her ongoing decline, but very rapid recent decline, we'll have to see. We'll assess him as we go.
How would you assess bereavement risk at this time for him?
Low, but once she's physically not there for him to take care of and to be present, when the lack of presence occurs, then I would say we could probably go to a medium.
Moderate.
He's a stoic man, and you know what's being expressed and what's going on behind the scenes can be very different things.
We'll definitely keep that in mind and work on, you know, doing some anticipatory grief work with the whole family that's involved.
Okay. Any other final words on this patient? We'll go on to our next admission. Mr. Jerry Meltzer. Am I pronouncing that correctly?
I think so.
Admitted 3/6/17. Diagnosis review of cerebral infarction unspecified. We'll try to dig for more information to figure out if we can figure out more what part of the brain's affected, so we can look at symptomology other than what we're seeing. And case manager,
Sure. Well, he's a 91-year-old male admitted with CVA and bilateral weakness. He has a secondary diagnosis of essential primary hypertension, unspecified dementia with behavioral disturbance, generalized anxiety disorder, disorder of the prostate, unspecific, and low back pain. The patient has had 2 CVAs in the past 45 days. On 1/17, he had a CVA that affected his right side. While in rehab for CVA, the patient had a second CVA which affected his left side. Since return to the ALF on 2/20, the patient has had 4 falls without injuries. The patient has had a 12-pound weight loss, which is an 8.5% loss since 1/3/17. He's had increasing agitation and reliance for ADL care. His PPS and KPS are 40, his FAST is 6E. The patient, I believe, is appropriate for hospice care. We have his medications right here. He is on amlodipine or Norvasc, aspirin, Ativan. Now, all of those would be, the aspirin and the Norvasc would be related to his primary diagnosis. So of course, do you agree?
Yes.
That it's okay? Okay. Then he's on Viscoladol for constipation, which is something
which is part of our
comfort pack. So all the rest of the medications I'm looking at look like that's our comfort pack, which would be of course related and covered.
Yes, and he's appropriate due to the fact, based on his scores and the most recent onset of his well-documented CVAs and the weight loss. That will make him appropriate, and we'll continue to monitor decline. So psychosocial?
Yeah, his primary caregiver is his wife, and there are several risk factors for her. She has some health issues herself. She's living on the assisted living unit in the same building with him, so she's close proximity to him, but she does, need her own help as well. They've been married for a long time, 63 years, so very long marriage for an older adult couple. In my initial visit with her, she was very tearful. She's open and communicative and, very easily engaged in life and relationship review. But she did have, some moments where she was getting choked up, trying to talk about it. So, again, she's, adjusting to his recent changes. And I think our focus for her plan of care is, working on that anticipatory grief support for her, as well as for their daughter, who also lives locally. I think the spouse has expressed some anxiety about going to visit her husband lately. She just is having a hard time relating to him in the way that he's presenting now, because he's sleeping more often and not as engaging as he used to be. So I think, helping her find a way to connect with him during her visits would be helpful. Because a lot of times he doesn't even remember who she is, which, as you can imagine, would be very hard. They are their Jewish religion is very significant to both of them, both the patient and spouse. So I think in future visits with the spouse, we're going to be trying to identify what sort of end-of-life traditions they want to uphold in the ceremony and planning for the patient. So, and I will let you all know of those as I find out.
And all equipment needs are met based on CVA. Got adequate everything in
Yes.
Okay. Now we'll move on
you have anything to add? For the Meltzers, I did get out to see them on Wednesday. I spent most of my visit with his wife. She did express to me that they are Jewish, but she didn't really go into any wishes that they have for the end of life. We went down to see him as well, and she introduced me. He was actually very alert on Wednesday. He was sitting up, talked to us, knew who his wife was. Actually, multiple times wanted me to leave so they could have privacy. Kept reaching for her hand and kissing her hand. So that was very sweet. And then she wanted to have a date night, so she ordered Chinese, and I assisted setting that up with her, and they ate together in the memory unit in like a little enclosed corner by the window. And the CNA there assisted with getting him to the table and everything, so that was great. And I told her I could come back next week and we could talk a little more about their faith together. So.
That's awesome.
And now we'll go down through active patients. Our first one is Marilyn Fernando, so nursing report.
Marilyn, Ms. Fernando is stable at this point. She is having continued bouts of shortness of breath and dyspnea on exertion, especially when trying to go to the bathroom or do any of her ADLs. We've increased the nursing support, so, aid support. They're coming in 3 times a week. And also we've alerted the staff at the assisted living that she is needing and requiring more help. So they're really playing a vital role in making sure that she's getting the care she needs. But she is stable. Her vital signs have been stable, and she has had several bouts with nausea and vomiting. We do not have a cause as of yet, but we're working on trying to pinpoint that and treat her accordingly. So, but she remains very appropriate at this point.
Chaplain?
When I saw her, she was sleeping. I sat with her for a while, and she didn't really wake up much. Toward the end, she did wake up and express that she was very ready for dinner, and so I told her I could sit with her until dinner was ready, and she said, no thank you. So I left and didn't really get much interaction with her.
Social work?
I'm noticing that she's a little bit more withdrawn. I think you see her more often, so I was wondering what your thoughts were.
Yeah, so I see her right now weekly. So recently she really is not engaged in any activities that she normally enjoys. Normally we color together or we just talk, and recently it's been more, I just want to be alone, I just want to lay down. She's talked a lot. I saw her yesterday, and she talked a lot about just not feeling well. She expressed a lot of just kind of her, I think, turmoil with being ready. She's very at peace with going, but her body's just not there yet. So we've talked a lot about that kind of spiritual battle also. So I think continuing to go see her would be really good for that support. Yesterday she didn't want to eat. She didn't really want to do anything. And I think a lot of that is because she feels ill, so she is less, willing to eat because it just makes her feel worse. So I've walked in the past 2 weeks, and her oxygen has been off on the floor, and she's just been kind of out of it. But I have noticed that the staff there have kind of increased their support and come and check on her more. But yeah, I agree. I think she's just become very much more withdrawn and very just kind of less engaged in activities that she previously really enjoyed.
I'm curious, what is her aid frequency?
Now it is 3 times a week.
Okay.
We'll probably look at upping it pretty soon.
Yeah, okay, yeah, that might be a good idea to just provide some extra support throughout the week.
Right.
And then we've also added one of our junior volunteers is going to visit with her.
Oh, good.
That's good.
So twice a month, so
Okay.
usually every other Saturday or Sunday.
Okay,
Oh,
that's
sure.
So
good.
she's getting a weekend visit.
Yeah, I was
from her.
gonna say.